Hi guys, and welcome back to Mommy Tales. So today I'll be sharing information about how endometriosis affects fertility. And this is information I got from a media training that I attended, and one of my colleagues, a journalist, asked the question, how exactly does endometriosis affect fertility? So this is the response that was given by one of the doctors.
What endometriosis is, for the people who don't know about endometriosis, is that instead, I think one of the endo warriors who I work with said it's like having your womb inside out. So what happens is that you have endometrial tissue, which is the inside of the cavity where the baby lies and which is where you bleed every month, outside on the tubes or on the ovaries, or even it has gone to the lung for some people, gone to the brain for some people, so it's in other places. So when you have a menstrual bleed, those implants also bleed, and they can cause a lot of pain and congestion. So it's a very chronic, debilitating condition where you have extreme menstrual pain. The patients, a lot of the patients don't even go to work for 2 or 3 days of the menstrual cycle, need to go get injections because of the extreme pain. So it's a really, really not a nice condition to have for any woman. It affects fertility in many ways, and one of the ways we think is that if it is on the ovaries, which a lot of times it is, it causes some reaction in your ovaries and your follicle count diminishes. And even the quality of your eggs is a bit low. So that's one of one of the things that endometriosis does for you. The other thing is sometimes it can even block the tubes. You can have little blood implants that go into the tube and cause some adhesion formation. So you can have blocked tubes because of endometriosis. And there's all this inflammatory response that we still do not understand, but we do think that it also affects the implantation. Because sometimes we do IVF, we get very beautiful embryos, but at implantation, we don't get the baby or the embryo implanting. So we do think that because the inflammation can cause some implantation problems. For a long time, we thought there's a lot of unexplained infertility. But in my experience, when you go in and do a laparoscopy, you'll find the patient has endometriosis. And it's one of the diseases or conditions, I would call it, that is chronic. It never leaves you. It starts at adolescence when you start your period, and it's lifelong. And now we're even wondering whether even after menopause you can have signs and symptoms.